Multiple myeloma, many people says it's a blood cancer or a bone cancer. It's a blood cancer which originates from the bone. Everybody has got a long bone and the bone is empty or hollow inside. But there is a liquid space from within this bone which produces red blood cells, white blood cells and platelets, which is called as bone marrow. And this remains the common thing for all of us, that there's a hollow space where it is being red blood cells, white blood cells and platelets are being originated. Every day 100 cells are formed and 100 cells die. There's a component of white blood cells called plasma cells. Every day 100 are formed and 100 are dying. But one fine day 400 starts getting formed and only 50 die. So they start getting accumulated within that confined space, what is called as bone marrow. So what will happen if there's a confined space? So it will start encroaching upon the red blood cells. It starts coming down. It starts encroaching on platelet, but the platelets are the last one to do that. Once they get accumulated in a large number, they keep on chelating the iron, chelating the calcium from the bone, which means like a termite, they're eating up the bone and bone is becoming hollow. And one fine day you have a fracture. That's why you can land up with the hospital. And these hollow bones, the calcium comes out. It can cause hypercalcemia. And once this hypercalcemia, the kidney tries to take this calcium out, they get deposited and you get a kidney failure. So the basic symptoms of multiple myeloma, what you can get is low hemoglobin because of the crowding of the space. Because of the hollowness of the bones, you can get a bone fractures. Third and most important thing is hypercalcemia or high calcium levels, which can lead to lethargy, constipation and muscle problems. And the last is the renal dysfunction or renal failure, where you have stopped producing the urine because of the deposition of these plasma cells into the bone marrow or the calcium into the bone marrow. So